I have to say that gross anatomy was one of the most profound experiences that I had in my training. Understanding this amazing collective of 37.2 some trillion cells, I think it was absolutely pivotal for me.
I think anatomy is the basis of all of the healthcare professions that we offer on campus here. There's been a huge movement towards more digital and digital-only dissection in a lot of anatomy programs.
We use those technologies. We use those things to enhance what we're doing in the lab. But it's a privilege to just learn from this body of ours. There's nothing that will give you the same profound understanding of the way the body works. Variation is the theme, and we get to see it not just from one donor to the next, but from the right side to the left side of the same individual.
Whether they are current students or whether we're thinking about students in the future, learning is best done in a collaborative setting. And what we've tried to do with the layout of the lab is make sure that students are the focus of the space.
This is not anatomy for anatomy's sake. We're teaching anatomy from a practical, hands-on point of view, being able to go in there and look at these structures and understand their relationships and what that means to be able to think critically and clinically about what they're doing.
We're not just talking about particular muscles. We're talking about how patients are going to come in with pain syndromes or symptoms based on their favorite activity. All of those experiences get down to anatomical structures and the impact of physiology on those anatomical structures. And what a wonderful place of wonder than to learn more about yourself and the commonalities that you share with someone else.